The American medical system was never designed to save everyone. It excluded women. It excluded blacks. It excluded the poor. 25 women spent their lives filling that gap anyway. These women saved countless lives while America pretended they did not exist. Before we get into it, hit subscribe so you will not miss our next look back at what America forgot. Number 25, Rebecca Lee Crumpler. In 1864, Rebecca Lee Crumpler became the first black woman to earn a medical degree in the United States, graduating from the New England Female Medical College in Boston. The country was still at WR. She was in her early 30s and had spent the previous 8 years working as a nurse because no medical school would take her sooner. After the war, she moved to Richmond, Virginia, and spent years treating freed black Americans who had no access to any other medical care. The doctors around her refused to treat her patients. The pharmacies refused to fill her prescriptions. She kept practicing anyway, making house calls on foot through neighborhoods that the rest of the medical system had decided were not worth visiting. She later wrote a medical guide for women and children that she published herself. She left behind the first medical degree earned by a black woman in American history and a practice built entirely in the space the system refused to fill. Number 24, Mary Eliza Mahoney. Mary Eliza Mahoney spent 15 years working as a maid, cook, and washerwoman at the New England Hospital for Women and Children before the hospital finally admitted her to its nursing program in 1878. She was 33 years old. She completed the 16-month program and became the first black professional nurse in the United States. She practiced for 40 years. She co-founded the National Association of Colored Graduate Nurses in 1908, which spent the next 4 decades fighting to integrate the American nursing profession. When the American Nurses Association finally opened its membership to black nurses in 1951, it was because of the groundwork Mahoney and the organization she helped build had laid across half a century. She left behind a profession that had room in it for black women because she forced it open herself, one credential and one refusal at a time. Number 23, Jessie Sleet Scales. In 1901, Jessie Sleet Scales became the first black public health nurse in the United States. She was hired by the charity organization Society of New York City to work in the black community of Manhattan at a time when white nurses would not enter those neighborhoods and black patients had nowhere else to turn. She visited patients in tenements, tracked tuberculosis cases, and provided care to families that the city's public health system had no intention of reaching. She filed detailed reports on every case she handled, producing records that demonstrated both the scale of unmet need in black communities and the effectiveness of trained nursing care in addressing it. Those reports were used to argue for expanding public health nursing into communities that had been excluded from it. She left behind a model of community health work and the documentation that made the argument for it impossible to ignore. Number 22, Martha Minerva Franklin. Martha Minerva Franklin graduated from the Women's Hospital Training School for Nurses in Philadelphia in 1897, one of the only black women in her class. She spent the next decade surveying black nurses across the country, writing 1,500 letters by hand to document the conditions they were working under and the barriers they faced. Then she called a meeting. In 1908, she organized the first meeting of the National Association of Colored Graduate Nurses in New York City, bringing together Black nurses from across the country who had been working in isolation, excluded from white professional organizations, and denied the institutional support those organizations provided. She spent the rest of her career building the organization she had founded into a force that could not be ignored. She left behind the first national professional organization for Black nurses and the understanding that isolation is a tool of exclusion that organizing can dismantle. Number 21, Annie Warburton, Goodrich, nursing education reformer. She spent the first decades of her career transforming nursing education in New York, serving as inspector of nurse training schools and systematically raising standards at institutions that had been treating nurses as cheap labor rather than trained professionals. When the United States entered World War I, she proposed to the Army that it establish a university-based nursing school to meet wartime demand, rather than lowering training standards to fill beds faster. The Army School of Nursing opened in 1918 with Goodrich as its dean. It trained more than 500 nurses during the war. After the war, she became dean of the Yale School of Nursing, the first university-based nursing school in the country, with an independent faculty and degree-granting authority. She left behind a profession that required university training because she refused to accept the argument that speed was more important than standards when lives were at stake. Number 20, Anita Newcomb McGee. In 1898, Anita Newcomb McGee convinced the United States Army to let her organize its nursing corps during the Spanish-American War. She was not a nurse. She was a physician, one of the few women in the country with a medical degree, and she used that credential to insert herself into a military bureaucracy that had no system for managing the nurses it suddenly needed. She reviewed applications, set standards, and selected the women who served. Her work directly led to the creation of the Army Nurse Corps in 1901, the first permanent nursing branch of the United States military. She later traveled to Japan during the Russo-Japanese War to study Japanese military nursing, and she wrote a report that influenced American military medical practice for years afterward. She left behind an institution that has served in every American military conflict since 1901, built by a woman who walked into a bureaucracy that had not asked for her and refused to leave until she had made it work. Number 19, Frances Payne Bolton. Frances Payne Bolton was a congresswoman from Ohio who in 1943 introduced and passed the Bolton Act, which established the Cadet Nurse Corps and funded the training of more than 120,000 nurses during World War II. The country was facing a critical nursing shortage with no plan for addressing it. Bolton created the plan, found the funding, and pushed it through Congress herself. She served in the House of Representatives for 29 years and used her position on the Foreign Affairs Committee to advocate for international public health programs at a time when global health was not considered a legislative priority. She funded nursing education out of her own fortune before she ever reached Congress. She left behind 120,000 trained nurses who staffed American hospitals during the war, and the legislative framework that proved the federal government could address a public health crisis when it chose to. Number 18. Alice Ball. Alice Ball was 23 years old when she developed the first effective treatment for leprosy in 1915, working as a chemist at the College of Hawaii. Leprosy had no reliable treatment. Patients were being forcibly removed from their families and confined to isolation colonies, some for decades, because medicine had nothing better to offer. Ball found a way to make cholmugra oil injectable and absorbable by the human body, producing a treatment that gave patients their first real chance at recovery. She died the following year at age 24, before her work was published. A male colleague, Arthur Dean, published her research under his own name, without crediting her. The College of Hawaii used her method for years. Ball received no recognition for more than 60 years. The university awarded her a posthumous medal in 2000, and the state of Hawaii declared Alice Ball Day in 2000. She left behind a treatment that relieved suffering for thousands of leprosy patients and a career stolen from her before it had fully begun. Number 17. Mary Putnam Jacobi. Mary Putnam Jacobi arrived in Paris in 1866 and was admitted to the École de Médecine 2 years later because no American medical school of sufficient quality would admit a woman. She completed the program and returned to the United States as one of the most rigorously trained physicians in the country. She then spent her career doing two things simultaneously: practicing medicine and dismantling the medical arguments used to exclude women from it. In 1876, she submitted an essay to Harvard's Boylston Prize competition under a name that concealed her gender, and she won. The essay used experimental data to disprove the then accepted medical claim that women needed rest during menstruation and could not sustain intellectual or physical work. She left behind a body of research that demolished one of the central scientific justifications for keeping women out of education and professional life, written by a woman who understood that the argument had to be beaten on its own terms. Number 16. Edna Aden Ismail. Edna Aden Ismail sold her car, her jewelry, and her house to build a maternity hospital in Somaliland in 2002, in a country that had been destroyed by civil war and had almost no functioning medical infrastructure. She had spent 20 years as a nurse and midwife, including a term as Somaliland's foreign minister, and she understood precisely what the absence of maternal care meant for the women in her country. She built the hospital anyway, with her own money, on land the government gave her. The Edna Aden Maternity Hospital has since trained hundreds of nurses and midwives and delivered thousands of babies in a region where women previously had almost no access to skilled birth attendants. She has spent the decades since fighting female genital mutilation across the Horn of Africa at significant personal risk. She left behind a hospital, a generation of trained medical workers, and the demonstration that one person with enough will can build an institution from nothing in the middle of a country that has almost nothing left. Number 15. Cicely Saunders. Cicely Saunders watched a patient die in pain in a London hospital in 1948, and she spent the next 19 years doing something about it. She trained first as a nurse, then as a social worker, and then as a physician, because she understood that the problem she was trying to solve required all three perspectives, and that no single professional identity would give her the authority she needed to change how medicine treated dying people. She founded St. Christopher's Hospice in London in 1967, the first modern hospice, built on the principle that dying patients deserve skilled pain management, emotional support, and dignity, rather than aggressive treatment that extended suffering without extending life. The hospice movement she founded now operates in over 100 countries. She left behind a model of end-of-life care that has changed how millions of people die, built by a woman who refused to accept that pain in the final weeks of life was an acceptable medical outcome. Number 14, Leila Denmark. Leila Denmark practiced pediatric medicine in Georgia for 73 years, retiring at age 103. She co-developed the pertussis vaccine in the 1930s, helping create the immunization that has saved millions of children from whooping cough. She continued seeing patients 5 days a week for decades after most physicians had retired, charging fees that families could actually afford, and refusing to let inability to pay prevent a child from being seen. She was one of the first women admitted to the American Academy of Pediatrics, and she spent her career in a medical establishment that had not expected her to last. She left behind a vaccine, a practice record that spanned more than 7 decades, and the straightforward demonstration that showing up every day for 73 years is its own form of argument. Number 13, Helen Taussig. Helen Taussig was partially deaf and had severe dyslexia. She was refused admission to Harvard Medical School because she was a woman, and she completed her training at Johns Hopkins instead, where she was admitted to the cardiology program, but barred from the courses that admitted male students. She learned to read hearts by placing her hands on the chests of her patients and feeling what she could not hear through a stethoscope. In 1944, she partnered with surgeon Alfred Blalock to develop the first surgical procedure for blue baby syndrome, a heart defect that killed most of the children born with it within their first years of life. The Blalock-Taussig shunt gave those children a chance to survive. It was one of the first successful cardiac surgical procedures performed on a child, and the procedure that opened the field of pediatric cardiac surgery. It is still in use today. She left behind a surgical technique in the field of pediatric cardiology, developed by a woman who was not allowed to hear the lectures that trained the men she worked alongside. If you are still watching, subscribe now so you do not miss what comes next. Number 12, Florence Sabin. Florence Sabin graduated from Johns Hopkins School of Medicine in 1900 and spent the next 3 decades producing research on the lymphatic system, tuberculosis, and blood cell development that made her one of the most cited scientists in American medicine. She was the first woman elected to the National Academy of Sciences in 1925, and the first woman to hold a full professorship at Johns Hopkins. When the university refused to promote her further, she left. She was 61 years old when she retired. The state of Colorado recruited her back into public life 7 years later to lead a sweeping reform of the state's public health system. She spent the next 5 years dismantling a tuberculosis epidemic and rebuilding Colorado's health infrastructure from the ground up. The legislation she drove through the Colorado legislature in 1947 is still called the Sabin Health Laws. She left behind foundational research, a reformed state health system, and the demonstration that a woman the institution had stopped promoting could spend her retirement changing the laws of an entire state. Number 11, Sarah Josephine Baker. In 1907, Sarah Josephine Baker was assigned to Hell's Kitchen in Manhattan as a city health inspector. The neighborhood had one of the highest infant mortality rates in the United States. 1,500 children were dying there every summer. She decided that was not inevitable. She developed a system of school medical inspections, trained midwives in safe delivery practices, promoted breastfeeding and safe baby clothing, and personally tracked down Typhoid Mary, a cook who was infecting household after household across New York City. The infant mortality rate in the areas she served dropped dramatically within a few years. She founded the Bureau of Child Hygiene for New York City, the first such agency in the world, and spent the next 15 years running it. She left behind a public health model that was copied by cities across the United States and Europe, and the understanding that infant mortality was a problem of systems, not fate. Number 10, Jane Addams. Jane Addams founded Hull House in Chicago in 1889, in one of the poorest immigrant neighborhoods in the city. She and the women who lived and worked with her provided child care, nursing care, legal assistance, job training, and English classes to people the rest of the city's institutions had decided were not worth serving. Hull House was not charity. It was infrastructure, built and run by women who lived inside the community they served. Addams advocated for child labor laws, workers' compensation, and women's suffrage, and she helped establish the juvenile court system in Illinois. She was awarded the Nobel Peace Prize in 1931. Hull House operated for more than a century. She left behind the social work profession, the juvenile justice system in Illinois, and the model of community-embedded care that put the people doing the work inside the communities that needed it, rather than visiting from outside. Number 9, Mabel Keaton Stoppers. Mabel Keaton Stoppers spent 20 years fighting to integrate the United States Military Nursing Corps. When the Army and Navy established quotas that limited black nurses to serving only black patients during World War II, Stoppers organized, lobbied, and refused to stop. She met with Eleanor Roosevelt. She spoke publicly about the absurdity of a nursing shortage so severe the country was considering drafting nurses while simultaneously turning away qualified black women who wanted to serve. The Army dropped its quota in January 1945. The Navy accepted its first black nurses the same month. She was awarded the Spingarn Medal from the NAACP in 1951 for her work. She left behind an integrated military nursing corps and the strategic lesson that combining public pressure, political access, and moral clarity is more effective than any one of those things alone. Number 8. Alice Hamilton. Alice Hamilton spent 2 decades walking into factories, mines, and mills across the United States, places no physician had bothered to study. She documented the specific ways that lead, mercury, arsenic, and other industrial toxins were destroying the bodies of the workers inside them. She was the first woman appointed to the faculty of Harvard University in 1919. Harvard required her to sign an agreement that she would not march in commencement processions or receive faculty tickets to football games. She signed it and went to work. Her investigations established the field of industrial medicine in the United States. Before her work, there was no systematic understanding of how industrial labor damaged human health. After her, there was a field, a body of research, and eventually a legal framework that required employers to account for what their workplaces were doing to the people inside them. She left behind occupational health and safety regulation in America, built by a woman who was not allowed to walk in her own graduation ceremony. Number 7. Lillian Wald. Lillian Wald founded the Henry Street settlement on the Lower East Side of Manhattan in 1895 after witnessing conditions in the tenement neighborhoods that the city's medical establishment was not addressing. She established the first public health nursing system in the United States, sending trained nurses directly into the homes of poor immigrant families, rather than waiting for those families to navigate institutions they could not afford and did not trust. She helped establish the Federal Children's Bureau and was among the founders of the Women's International League for Peace and Freedom. By the time she retired, Henry Street had grown from 2 nurses to more than 250, covering every borough of New York City. She left behind the public health nursing profession and the principle that healthcare delivered inside communities reaches the people who need it most, written into the practice of nursing systems around the world. Number 6. Dorothea Dix. Dorothea Dix walked into a jail in Cambridge, Massachusetts in 1841 to teach a Sunday school class and found mentally ill people held in unheated cells without clothing, without treatment, and without any legal distinction between their situation and that of convicted criminals. She spent the next 2 years visiting every jail and almshouse in Massachusetts and writing down what she found. Her report to the Massachusetts legislature in 1843 is one of the most consequential government documents in American history. It resulted in the expansion of the Worcester State Hospital and the beginning of a national movement to build dedicated psychiatric facilities. She lobbied legislatures in more than 30 states and across Europe. During the Civil War, she served as superintendent of Army nurses, overseeing more than 3,000 women. She left behind 32 psychiatric hospitals and the first sustained legal argument that mentally ill Americans deserved treatment rather than punishment, made by a woman who walked into a jail one Sunday morning and could not look away from what she found there. Number 5. Virginia Apgar. Before Virginia Apgar, there was no standard method for assessing a newborn's condition in the first minutes of life. Babies died in delivery rooms because no one had a reliable way to identify which ones needed immediate help and which did not. Apgar was an anesthesiologist at Columbia University who in 1952 designed a scoring system that any nurse or doctor in any delivery room in the world could apply in 60 seconds. The Apgar score measures appearance, pulse, grimace, activity, and respiration. Each is scored 0, 1, or 2. A total below 7 means the baby needs help. It is still used in every hospital in the world today, unchanged from what she designed in 1952. She left behind a test that costs nothing to administer and has saved millions of lives, invented by a woman who looked at a preventable death and decided that acceptable was not the same as inevitable. Number 4, Mary Edwards Walker. Mary Edwards Walker is the only woman in American history to receive the Medal of Honor. She earned it during the Civil War, serving as a surgeon and crossing enemy lines to treat wounded soldiers on both sides of the conflict. She was captured by Confederate forces and held as a prisoner of war for 4 months. After the war, she continued practicing medicine and advocating for women's rights. She wore trousers because she found them practical, and she refused to stop when the law threatened her with arrest for it. In 1917, the government revoked her Medal of Honor as part of a review that stripped the award from hundreds of recipients. She refused to return it. She wore it every day until her death in 1919. Congress restored it posthumously in 1977. She left behind a record of service the country spent 60 years trying to erase, worn on her chest every day until she died. Number 3, Susan LaFlèche Picotte. Susan LaFlèche Picotte graduated at the top of her class from the Women's Medical College of Pennsylvania in 1890, becoming the first Native American to earn a medical degree in the United States. She returned immediately to the Omaha Reservation in Nebraska and served as the only doctor for a community of 1,200 people spread across 1,300 square miles. She made house calls on horseback in all weather and often worked without payment because her patients had nothing to give her. She later founded a hospital on the reservation, the first tribally funded hospital in the United States, built because the American medical system had no intention of sending care to the people who lived there. She spent her entire career serving a community the system had written off, without the institutional support, the salary, or the recognition that white physicians doing less difficult work received as a matter of course. She left behind a hospital her community built for itself, because no one else was going to build it for them. Number 2, Mary Breckinridge. In 1925, Mary Breckinridge rode a horse into Leslie County, Kentucky, one of the most isolated communities in the United States. The nearest doctor was hours away. The maternal and infant mortality rates were among the highest in the country. She had trained as a nurse midwife in Britain specifically because she intended to come back and do this. She founded the Frontier Nursing Service, recruited British nurse midwives to join her, and built a network of small clinics connected by horseback trails across the mountains of eastern Kentucky. Between 1925 and 1939, the Frontier Nursing Service attended nearly 12,000 births, with only 11 maternal deaths. She built the first rural healthcare system in America, designed for the people living furthest from existing care, funded it herself and through donations, and ran it for 40 years. The Frontier Nursing Service is still operating in Kentucky today. She left behind a healthcare model that proved distance was not a reason people had to die. Built by a woman who saddled a horse and rode into the mountains because someone had to. Number 1. Clara Barton. Clara Barton had no medical training when the Civil War began. She had been a clerk at the United States Patent Office, one of the first women to hold a federal government position at equal pay to men. When the war started, she organized the collection of medical supplies on her own initiative and began delivering them directly to the battlefield, working under fire at Antietam, Fredericksburg, and Cedar Mountain when the Army's own medical corps could not keep up with the wounded. She was called the Angel of the Battlefield. After the war, she ran the Office of Missing Soldiers for 4 years, personally responding to more than 63,000 inquiries from families searching for their missing men and identifying the remains of more than 21,000 soldiers. She traveled to Europe, witnessed the work of the International Red Cross during the Franco-Prussian War, and came home to spend the next decade convincing a skeptical American government that the United States needed its own chapter. She founded the American Red Cross in 1881 and led it for 23 years. The American Red Cross has responded to every major American disaster since. It has delivered blood, shelter, and emergency relief to millions of people across more than a century. It was built by a woman who showed up to a battlefield with a wagon full of supplies because she looked at what was happening and decided that someone needed to do something about it. She left behind an institution that is still doing something about it today. If you enjoyed this video, subscribe, then watch the next video above.